Hi, I'm Dr. Jon Dabach, and in today's short talk, we're discussing, diving into what you do when your spouse or your significant other has OCD. Now, there's different kinds of OCD, and there's different ways that it manifests. Now, if your wife or your husband or your partner is just kind of anal retentive about things being clean, my personal advice is kiss their feet, say thank you, and move on, right? If it doesn't get to the point where they have magical thinking, where their anxiety gets out of control and they have to wash their hands 20 times, or they're making rituals where they have to like touch a doorpost and kiss it, or anything that's out of the ordinary, and it's really just about cleaning, let's stop calling that OCD. Some people are just persnickety about cleanliness. That's not the same thing. Okay, OCD tendencies, obsessive-compulsive disorder, is when someone is obsessive and there's compulsive behavior, meaning they have to do it, right? I cannot leave the room unless I open the door 4 times to make sure that it's working, or sometimes it's magical thinking, like the world's going to end if I don't open the door 4 times, or my mom will get hit by a bus if I don't open the door 4 times. That's the nature of true OCD. Is there's one of those elements where it's not normal behavior, it is compulsive, they can't control it, or they're having trouble controlling it, and it's obsessive. It has this I need to do it kind of thing. And it's a disorder. That's where the OCD is. So I didn't mean to spell it all out for you there, but it's important to differentiate because there are a lot of women who come from a very clean house, not as many men, but there are still some men. I would say it's, probably a 10-to-1 ratio in my experience, but there are a lot of women that come from a clean house, take a lot of pride in it. They will vacuum the cushion covers every day. They will clean things. That's not necessarily OCD. They just might be incredibly clean and anal retentive about cleanliness. Now, if you're washing, let's say you get takeout and you're washing the French fry cardboard box before you put it in the trash, now you're going a step too far, right? Now you're kind of getting into that line of cleanliness that doesn't make logical sense. And so that's where it gets a little bit tricky. So the first thing you need to do is watch videos like this. Educate yourself about understanding where OCD comes from. Really get a sense of why it happens, what are the deep disturbing thoughts that they're worried about underneath. Sometimes they don't know. Try to get educated, try to find the thought patterns, try to connect with a therapist. Ignorance is not bliss here. When it comes to mental disorders, the more armed you are with information, with psychoeducation, the better off you're going to be in being able to help your partner get over certain things, the better you're going to be able to help them cope, and the better you're going to be able to cope because you have realistic expectations. Number 2, the second thing you need to do is communicate openly. You have to talk to your spouse or your partner about them. Ask them how it feels, what they need from you. Open communication builds trust. It builds a bond that is typically unbreakable if it's done with consistency. And that kind of communication also helps people get better within their disorders because they feel like they have an ally, an advocate that's rooting for them as opposed to somebody who puts pressure on them to change. And if you have OCD, that pressure can actually exacerbate the problem. A lot of times when we see children with OCD, if their parents make too big of a deal about the OCD itself, or even add other stressors in their life, the OCD tendencies will escalate. So you want to try and bring that pressure down by being an advocate, being calm, being patient, and all that kind of stuff so that they feel like you're safe to be around and that you're not being judged. Now, there is a fine line. So the next thing I want to say is you want to avoid enabling. You don't want to feed the monster, right? So if their compulsions seem outlandish and you feel like you're being kind by embracing it, that's not exactly the right way to go. There are certain mental conditions like dementia, like Alzheimer's, where the best thing to do is embrace the delusion, because if you tell someone who thinks that let's say their husband who died 10 years ago is coming to pick them up and you say, hey, he died 10 years ago, they're reliving the trauma. It's a whole different thing. Not with OCD. Right? With OCD, if someone says, I got to open the door 4 times, and you say, oh, okay, or the next time you go through the room, you go, oh, aren't you going to open the door 4 times? You've just triggered it, right? And you're not being nice, you're actually enabling the problem. And so if someone says, I need a 10 extra minutes to come, meet you in the car because I got to do my 17 OCD things, and you say, no problem, take your time, that's enabling. You want to draw a hard line in the sand that you're not going to enable the behavior any more than you absolutely necessarily have to be functional in the relationship. And listen, I think this is an important time to mention that you are probably not qualified to deal with it. I am not an OCD therapist. I don't deal with it on a counseling level when it's very acute. Even I will refer out. Okay, I will be able to recognize it probably quicker than you will. I'll be able to give some basic coping techniques, but the next thing out of my mouth is you need a good OCD therapist. You need someone with expertise in this area who's going to help you through this. I'm not the guy, right? And so, and I'll usually pull out my Rolodex. Well, it's Rolodex, like a little thing. We all use the digital, the internet right now, but I'll pull out a number from my cell phone of someone who I feel like is a good fit. And you should be doing the same. If you notice your partner is dealing with it, you should be encouraging them to get professional help because it can escalate. It's one of those things that does not go away without help and without good, proper guidance and mental kind of exercises. So it's going to get worse typically if you don't treat it. And you need to set boundaries. So if the person's not going to get help, if they're going to get angry when you don't enable them, you need to be able to say, I'm leaving the relationship. Sometimes you leave for 10 minutes and you take a break, and on the other end of the spectrum, you leave permanently. But that's the way you enforce boundaries. You take yourself out of the relationship for a certain amount of time or permanently. It's up to you, depending on how bad of a boundary, how big of a boundary was crossed, but you need to remove yourself from the situation. So set good boundaries of what you will and won't tolerate, communicate them so that people don't feel blindsided, but then stick to them. Okay, it's really crucial. And you have to be patient. Being patient with people who have mental disorders is par for the course. I don't care if it's schizoid affective disorder, obsessive-compulsive disorder, bipolar disorder, any kind of mental condition or personality disorder is going to require a tremendous amount of patience. If you're not up to the task, you have to ask yourself if this is a relationship you can actually be in. Because without patience, all of these things are going to fail and drive you to be a very miserable and bitter partner. So gear up and get ready for some patience. If you don't have it, you're probably going to need to have some therapy of your own in order to learn coping mechanisms and practice self-care. And that's another thing that you have to do when you're dealing with a partner who has OCD or really any mental disorder. You need to practice self-care, right? So make sure you take time. You take time for yourself to vent. You see your own therapist, you spend time with friends, with family. If you need alone time, if you need some space, you have to be able to advocate for yourself. Practicing self-care, sometimes meditation or exercise, eating right, all those things are crucial at varying levels for different people. Exercise isn't so crucial to me, as an example, right? But meditation is, and rest is, and alone time is huge for me. I mean, when I'm dealing, sometimes I'll have 8 or 10 sessions in a day with couples, and there's a lot of volatility. I need decompression time away from my wife, away from my 4 kids. I know I can always get it at night when they're sleeping. I tend to go to sleep later than they do. So I found a way to do it for myself. You should do the same. Whatever it is, if you need exercise time, you need a certain, procedure or service done for yourself to make you feel good, go ahead, do it. Do it. Get what you need done so that you can feel whole. The other couple things I'll tell you is sometimes it's helpful to use humor. It's tricky. It's a little bit of a tightrope walk when someone has a mental disorder, but if you walk on eggshells around somebody and never acknowledge the 800-pound elephant in the room, it can feel overwhelming. And so sometimes poking fun at it can help lighten it and make people realize that you're well aware of the situation and you're accepting of it. Again, if you don't have a great sense of humor, if you're not great at really reading the room, it's dangerous. But if you have a natural ability, it can lighten the load of carrying the reality of what these mental disorders and challenges really bring to the table. And be consistent. Whatever your methods of coping are, whatever your methods of setting boundaries are, whether it's in writing or verbally, or what you do when boundaries are crossed, try to be consistent. It helps you to learn how to cope with things, because there are tools that you find that will help you regularly. And it also helps set the table for consistency with your partner, so they know what to expect. And having realistic expectations of what you can and can't offer in a relationship makes for a healthy relationship. Again, I'm Dr. Jon Dabach. I hope you found this helpful. Like and subscribe, and I'll see you next time.